As Lawrence mentioned, my name is Lori Most. I'm the founder and CEO of Binary Bridge. So that is the company. And then our product is called Backpack EMR. And so really what we're trying to do here is really bring health equity and then also clinic modernization to emerging economies. So we're really looking outside of the United States. We do not operate currently in the US. It's all in other countries. So I thought to start off with a little bit more about me, and I hope that that will help you to understand a little bit more about this application that we're talking about. So as a lot of you know, starting a company is a big deal. It takes a lot of takes an interesting person, I guess I would say, and a lot of risk. So I wanted to give you some background on me. So I am interested in everything and was during school. So if you think about what an entrepreneur is usually thinking about, constantly learning, right? I'm constantly loving to learn. And so you can see here, I started out in aerospace engineering. So I did that for a few years, including a mechanical engineering job with filters. But by my third year or so, I decided to move over into pre-med. So I took all my pre-med requirements, took my medical exams. I started applying to medical schools. And then I changed my mind and decided I really loved math and wanted to get back into something more technical. So I went and got my math degree. And then I decided I wanted to teach. So I thought I would be a professor. I went into education, so the College of Education, to get my master's degree in that. And then decided I wasn't really as into teaching as I thought, and I wanted to move more into technology. So I did get a technology, kind of went to a boot camp, started to learn to code, and that's where I really started in earnest to do software development. So I've been developing software for about 20 years now. I absolutely love it. It was a great choice from an industry standard for me because I could do lots of different things. So you can see Target here is retail, C.H. Robinson is third-party logistics, so transportation, Jostens is rings and yearbooks, United Healthcare is healthcare and insurance. The Dallas Cowboys, that's an American football team. I got to work with them, and SPS Commerce doing some e-commerce. So I loved the kind of variety that I got to play around with there. And then I threw this on here as well as a risk taker. So I have played rugby for about 15 years. So I played for the university and then post college as well as semi-professional teams and for the US. And in retirement, I've picked up ice hockey. So I'm a big fan of competitive sports and taking those risks. It's all high contact. So I just wanted to give you that background on me as we move forward and kind of talking through how this journey kind of happened. So this is me. I wanted to point out on the slide these 3 points here. So sort of my mantra here and why I'm really passionate about what I'm doing with Backpack EMR is I really believe everyone deserves access to high quality healthcare. I'm very passionate about this, and I'll walk through how this all got started. I do believe that modern software solutions are for everyone. I think that modern software has kind of been secluded. You know, they talk about Silicon Valley and a lot of those sort of places where you have this modern and professional tech, but I think it's for everyone. I don't think it needs to be so secluded. And then my last one here is we must be faster and more reliable than paper. Paper is a great tool. It's inexpensive. And if we can't be more faster and more reliable, then we should just be using paper. So this is another one of my mantras that it really has to be fast. So if we're going to do it, we're going to do it right. So here's my quick intro to global health. So this is a pretty big change from a lot of what I had been doing previously. So I wanted to just give you how it all got started, which will give you some insight into this app as well. So this started with my sister. So she is the one in the medical field. She is a orthopedic surgical physician assistant, and she would go to Peru and do surgeries a few times a year. So I was really excited about what she was doing, but she would come back frustrated and exhausted. And she was just thinking there has to be a better way. And so I decided to come along with her just to see if I could help with some efficiencies with what she was doing. So I experienced it for myself here. This was a clinic that we ran. So there were about 100 patients waiting to get through. There were just 2 surgeons who were seeing patients. So it took all day. We were doing things on paper, which, like I said, sometimes that's the right tool. So capturing things on paper that would then follow them into the exam room as well. And one thing I quickly saw as an issue was a lot of these patients they'd seen before, and they didn't have access to those papers. And so they were kind of re-guessing what they did, trying to get from the patient what happened the last time, trying to figure out where those, snapshots of the x-rays were. So there was some loss of efficiency there and loss of continuity of care. And then at night, they all got around this table to figure out who was going to get surgeries the next day. So you can see me in the background here. I look very unhappy with this whole process because it took us till 1 o'clock in the morning, and they had to shuffle papers and photographs on multiple different devices on people's phones or on the iPad minis. They had little minis that they used just to see the different x-rays and things. And it was really a struggle. So again, there was a lot of loss of efficiency and time right here. So they did perform about 30 surgeries. So this is my sister in surgery. And then afterwards they did post-op. So they went through and did post-op, and I saw a little bit of inefficiency here as well with finding the papers, trying to keep those updated while they were doing the rounds. And then after the team left, leaving the local team, so the 2 team members here were the ones who continued to follow up with these patients, and they didn't have access to all of the information, nor could they kind of project that information to the surgeons who had gone back to the States. So there were a few issues that I saw right away. So can we help solve these problems with technology, and will it work? So this was the big question in my mind, and this is really how Backpack EMR got started. So there are pretty intense requirements, and these should look very familiar to all of you in healthcare as well. So we needed something that was portable, rugged, and lightweight. And this was because we were going out and traveling with these different devices. Additionally, we needed some sort of central database that was accessible worldwide. So in this case, we were using remote doctors and surgeons from around the world. So they could have been from anywhere, but in order to keep tabs on and keep following up with those patients, they needed access to those patient charts in some way and securely. So we needed some central database. We also needed something that was very easy and efficient to use, no training. If you can imagine, we couldn't spend 3 days of training before we were going to go through some of these clinics. It had to be very easy to use. Data sharing without the internet. We did not have access to the internet, and it was not consistent, but we still needed to share data during our clinic. So we needed the registration information for that patient to flow into the exam room, which needed to flow to pharmacy, et cetera. And then we also had to do that without electricity. So we were not assured of having any sort of plugins in the little clinic area where we were. And so we weren't able to use what a lot of you may be familiar with as a server. So a local server, we couldn't plug that into the wall because there were no outlets. So we needed to find a solution that did not require a local server. Additionally, it had to be fully functional offline. Like I said, we didn't have access to the internet or electricity. Had to be low cost. This was really important to me, that we didn't build something that was going to cost a lot of money, and then it had to be sustainable, because it couldn't continue to cost this team more and more money every year to help sustain this. Then we're back to paper, in my opinion. And then this point, faster than paper. So similarly with the cost, if we can't do it faster, then you may as well go back to paper. So these were all of the requirements that I was working with in order to build this. So we put together this innovative architecture, and I won't get too far into this. We can always talk more about the architecture afterwards, but at a high level, I wanted everyone to understand, and it's really important, that it does work completely offline. So we've got tablets that you can use offline, but then what we did is we did an offline peer-to-peer sharing network. And so what happens is the data will go in at patient intake, you'll put your information in, and it will immediately send to all of the other devices. Now, all of these other devices have now stored that data. So now there's like mini databases here. So all of the data is on all of the devices all of the time. Now, what this does for us is we don't have to plug anything into the wall. They're just tablets. They run for 10 hours a day. Additionally, if one of these happens to get lost or broken or stolen, it doesn't matter. All of the data is on all the other devices. So there's no loss of data. So your data is very secure in this case. We did build in a lot of security around if it does get lost or stolen. I can always talk more about that too. But this is one thing I wanted to make sure you understood about this, is that offline capability. So then if you do have internet, whenever you have access to that, one device can be connected to the internet and all the data will go up to be backed up in the cloud. And at that point, then it can be accessible through a lot of security through another website as well. So that was what we went in with. So here's our pilot, our moment of truth. This is one of the developers that I had working with us. Is it going to work? And of course it did. Otherwise we wouldn't be talking here. So yes, it was successful. The team found there were no waiting lines. This is something they were expecting, to have long waiting lines, because they thought they were, implementing an EMR and it was going to be complex and troublesome, excuse me, and take them a lot more time, but it didn't. In fact, it made things smoother. So no waiting lines, smooth exams. The surgeon rushed out and told me, "Oh my goodness, Lori, this is so great. It's so easy." I said, "Yeah, I know, we built it that way. Yes, it is." So they didn't believe it until they used it. Fast surgical planning. So we just projected onto the wall one of the tablets. And at that point, they could all look at it at the same time. They could make quick decisions. We were all in bed by 8 p.m. You can see here, and everyone had access for follow-ups as well. So we were really excited that we had solved some of those issues with this new system. So here's essentially what I felt like after this. We were faster, we were more efficient. There was less exhaustion on the team. It was a less effort. They got more sleep. We were able to cut their costs down. There was more visibility to all of the data and better care. So I wanted to tell this story so you could see how this sort of started, so you can see the baseline for this architecture that we started working on and the capabilities. So then we moved into mobile clinics. This statistic has been around for a long time, that half the world's population lacks access to basic healthcare. And this is, again, why you are all getting together. You're trying to get better the access to healthcare and really spread that high quality care. So this is what we were trying to do. I did a pilot in Haiti. So this is part of Haiti. It's a small island off Haiti. You can see bigger Haiti is in the distance. This is Ile Vache. You can see just from looking at it, there's no internet or electricity coming to this island. So we did pop-up clinics. So we run around to a lot of these little islands and we did these pop-up clinics. So we were able to do patient intake, kind of sitting on this log. We had people go back behind here to do some vitals and labs. Then you can see we had different individual consults here with different providers. And then we also had our pharmacy kind of in the back. So this is a small little pop-up clinic, but I just wanted to show you there was truly no internet or electricity anywhere near us. So we considered that a success. You can see here's a few more shots. Very portable that they were using with their devices. We have these rugged keyboard cases. I've got one, I don't know if you can see my camera here, but I've got one here that you can see. They're just like little laptops with that tablet. So wanted to give you just a few quick shots of the mobile clinics. And then here we were in Kenya. So we did do one, we saw 1,000 patients over 2 days. So I wanted to show you this so you give you an idea of the efficiency that we were able to reach, even though we were using a new EMR. It was new for everyone. We had about 40 volunteers. We did a 1-hour training session the day before, and we still had new volunteers coming the same day. So we did a quick 15-minute session in the morning, and they were all using the system. And so we were able to jump through registration. We had multiple registration people. We had them working in vitals. We had 8 different consultation rooms going on, and then the pharmacies. We had about 20 devices, all sharing data constantly throughout the day. And then we were able to, the next day, give a report to the Ministry of Health and all the stakeholders. So we had 6 organizations, including the Red Cross and a few others. They all were given reports of what happened on this, during this clinic. So that was, again, something that was a value add, as they typically would take about 6 months to get reports out, and they were not this in depth. If you can imagine, with paper, it was really difficult through 1,000 sheets of paper to just gather basic data. They weren't getting detailed information like we had. So with this, all going through, so the first trip I went on was in 2013. At this point, we're kind of as we move forward with mobile clinics, we started moving more into health centers. So the biggest challenge was complete here, just being able to operate without the internet or electricity. So now we started more on feature sets. So you can see here, we've got multiple permanent clinics now who are using us. This particular group has been using us for almost 4 years now in their clinic. They've captured in total probably almost 20,000 patients, but up to 10 to 20 visits per patient over the course of those 4 years. So quite a bit of data. Part of getting into health centers was implementing telemedicine. And of course, this came with COVID as well. So as you can imagine, telemedicine has been exploding, and we wanted a really inexpensive and easy way to do this. If you're using Backpack EMR already, you can see that this was in Sierra Leone. We had a clinic who had local team members. They didn't have all physicians, so we had to get some physicians that were outside of their area. So there's a Nigerian physician online, so you can see him here, and the local team members gathered their name, their demographics, the complaint, the vitals, all of that, put it into Backpack EMR. They had an internet connection so that that provider could log in and see the chart and then talk to the patient and input his exam. He inputted his prescriptions, what he was prescribing for the patient, and the treatment plan. And so the local team had all that information, and the patient was able to get a step up on quality of care. So this is another thing that is enabled with just using Backpack EMR. And then, you could use, honestly, any telemedicine platform for a video chat if you wanted to do live. We do also enable asynchronous. So if a local clinic wants to gather information and wants a second opinion on a specific chart, they could send that one up to the cloud and get a remote specialist to just take a look and give feedback. So with that, I just wanted to highlight some of our specialty modules then that we've added. So we do have primary care, and we recently produced a pediatric module. We have general surgery, orthopedic surgery, as was our first, cleft lip and palate. We recently put out an inpatient module as well to track inpatient people in beds and wards. We've added immunizations, and we do have labs and pharmacy as well, along with virtual care. So we are in the process of building out dental and vision, along with working on a maternal health module. And then we're further building out some e-consults, so really to connect with external specialists as well. And then from a clinic operations perspective, as we said, we started off with mobile clinics. And so the operations piece wasn't as important to those clinics. But you can see now we're starting off with inventory management, and part of that will be medications. We'll add in there the medical supplies, and part of that will be services and fees for service, which obviously will tie right into billing. So we're working on getting this by the end of this year, getting a first iteration of that out. So it'll be fairly basic, and then we'll build off of that as well. Part of that will be adding in the insurance integration. So we know that there's a lot of insurance that can be added in, along with then the capabilities of sending out insurance claims. So we're working on that as well. We're also working with an AI team out of Nairobi on decision support. So we want to make sure that as you are adding in those diagnoses, we can start feeding you in some of the common diagnosis for those symptoms, and then also the treatment plans that are typically most effective. And it's through AI, so it's constantly learning on what in your region is being most successful and in your clinic. So we're working on that right now, along with adding in things like appointment scheduling, some stock integration, device integrations. We're working with some smart glasses and other diagnostic tools to import that data right into Backpack EMR, so you don't have to type that in. And then more on-demand reporting. So where are we now? So we have come a long way. You kind of saw the journey. So where we are right now, I wanted to give you just a quick highlight. So we have made some traction here. We've got about 34 different groups. Some of those groups have multiple clinics. They are spread out across 24 countries. So we have quite a few here in Latin America, but then we also have some in West and East Africa as well. We do have a high retention rate, and I put that in just so you could see, as an EMR, our clinics and our clinicians really like using us. So we do have a high retention rate. We don't have a lot of people who sign up and then drop us. So I just wanted to put that in there just so you know as well, sort of adoption is high. So a high level solution overview here. So we do have data capture that happens through our app. And then we also have it through a web portal. So we do have basically an online version of the app that you can go in and view patients and enter patients. There are a few different use cases. The app is definitely used most often for home visits, community health workers, and mobile clinics, health centers, and hospitals. So you can use that pretty much universally. It can be used offline or online. Right now, it's only on tablets and phones as an app. So we are working right now to build that into a regular universal app that can be then applied to laptops and desktops. So we want to enable that. We're hoping by the end of this year, it might spill a little bit into January. And then we do have the online version of the web portal. So we'll still have that. That's primarily used by remote patient or remote surgeons or specialists who might want to give second opinions or e-consults. And then we do have an admin tool as well, which is where you set up your users, devices, campaigns. A lot of the security pieces are in there and custom lists. We do have a reporting dashboard. It's pretty basic right now. We've got the first iteration out, and now we're continuing to build off of that. So then now you can start to get those in your inbox every week. So we'll just auto-generate those for you, along with detailed Excel reports. So we do have those as well. And so when you want to really do some deep dives into diagnosis or treatments or root causes for things, we can give you detailed Excel reports. And so I just wanted to show you quick this end-to-end clinic management. So we have a lot of partners. We are partnering with a lot of different teams that we can really give a solid platform that has a lot of snap-in pieces. So we are working with telehealth platforms to sort of integrate into those as well, along with telespecialists. So Beam Healthcare has offered telehealth specialists. Some of these we're working on getting for pro bono. Some of those are also could be very, very low cost as well, though. So these are some telespecialists that are available to us. This is the smart glasses and remote diagnostics we were talking about. And in fact, the founder of TeleView and the executive director of Ohana One will be presenting next week. So I won't say too much about these. You'll get to see these cool tools that we can integrate with. But the smart glasses really help for surgical procedures if you wanted to get feedback and guidance from someone who's remote. Could be someone who's just in an urban center or hospital down the road or in a different city. Could be someone in the US or in Europe who maybe is a tight specialist on that surgery. Similarly with remote diagnosis or diagnostic tools, we are trying to integrate with that so it can reduce some of the inaccuracies sometimes that are, hand entered. It can streamline that as well. So it'll take, 4-in-1, like your temperature, and it will automatically take an EKG and import that right into the EMR. And then personal health records are one of my favorites. This is a great step in having patients own their own data. And the founder of Andaman 7 is also going to be speaking next week in a webinar, and he will talk about Andaman 7, which is a fantastic tool. We are working right now to send through Bluetooth the patient chart that's created in Backpack EMR so that you can have that patient record. It's your data. It's you that they're talking about. So you should own that data. And so we are through Bluetooth going to pass that on to your phone so you can have it now offline. You can take that into a dispensary. You can take that to a specialist. You now have your record. And if there's another group who's using Backpack EMR who's integrated with Andaman 7, they can import that record if you allow them. There's a lot of security around that too. So it's a pretty cool tool. I wanted to mention it and just get you ready so you can join next week and hear more about it. And then VBEG Medical. So we are looking at really helping with the supplies and keeping those in stock and ready at the clinics. And VBEG Medical is in East Africa. They are in Rwanda and Kenya, and they've got offices in the Dominican or the DR of Congo as well. They've also got a few in Burundi. So they are sort of expanding, and we're working with them to possibly then help us out in Uganda as well. So this is my last slide here before we jump into the demo. So this is our vision and goals. We really want to improve the quality of care in remote communities, increase the impact of healthcare workers, lowering costs for clinics. A lot of the lower costs come from the automatically generated reports. That's huge. It takes a long time otherwise to generate those. Ensuring medical supplies are in stock, that is also a cost saver. Giving access to healthcare records directly to the patients, bypassing interoperability. That is a way to get around the very expensive and difficult to do interoperability within, multiple EMRs across, a county or a country. But you can have that with personal healthcare records. Reducing reliance on foreign aid for local clinics with those technology improvements and metrics and more access to medical supplies on credit. So a lot of that can happen without having to rely on a lot of that foreign aid coming in, and really empowering local clinicians with some mentorship. That can go a long way. Just a little bit of mentorship from some remote specialists can really help to train local teams. So with that, I was just going to dive into a demo, and then we can certainly take questions after that as well. I'm happy to do a deep dive into the technology or security or data or functionality, but I can just get us started by seeing it. Sometimes that answers a lot of questions off the bat. All right, so I'm going to run through this pretty quickly. We're already at about 30 minutes here. So I want to give time to expand on anything that you're really interested in. So this is the tablet here that you can see. I've just connected to it. I've got it here next to me. We typically use tablets that have really rugged keyboard cases like this. So this is typically what we would deploy. They look like a medical device. We have yet to have any devices stolen in the field. It doesn't look like it's a tablet even. It just looks like a little laptop. And because it looks so rugged, people don't even think that it's really that valuable. The other thing that's nice is we've got keyboard cases where it pops off. So you can just use the tablet alone if you really want to, or you could snap it right back in for the keyboard case. So that's just a little bit on the equipment side. So here is Backpack EMR. It's just an app. I'm going to go into our staging environment, which is the pink one. Typically it would be blue. That's our real production line. So this is just, like I said, a testing environment, and I'll walk you through just a regular primary care clinic. So it's called a mobile clinic. You can have multiple different bundles of patients. So this one happens to be a mobile clinic in Kampala. If I'm going to jump into, let's say, my user, I'll type in my user password. So we do have everything's password protected, everything's encrypted. And then we also have different ways for you to approve devices to access the patient information along with users. So you have a lot of control over security. So here would be your list of patients. This is just like I said, all fake patients. And I will go through really quickly. I'm not going to walk through every field, but I'll just show you how you would do things. So if you were going to register a patient, it's simply plus, you just add that patient. If you have an existing patient, you would go search for them, go into that new patient and update them. Very similar process though. So you can run through it and enter in all the very high level demographics data and information. One thing that is really, well, I'll start typing things just so you can see it. So I'm going to put myself in here. We do have a little wheel here, so you can enter in the birth date. If you're unsure about a date, you can put in an age and it will backfill that. All of our drop downs work the same. As I was talking about with the efficiency, we're looking for the least amount of typing as possible. So as much as we can do on screen and quickly, we will. So we have done a lot of list of values. So the key piece is to start typing in maybe 2 letters and it will shorten your list. If I'm looking for a teacher, I can see it on here and select it. So now I don't have to type out teacher. So you'll want to select something from the list if at all possible. You can also type over it. So if my value is not in the list, I will just type over it. Again, it's that we're trying to be as flexible as possible, but with still being quick. So then you can also put in some insurance here, address, phone number, email, contact name, and then we do have photo enabled. So you can take a photo of that patient. I'll just take one really quickly here. That really helps with identification. And so we found a lot of teams who really like this. Of course, you need to ask permission. There are all kinds of different consent pieces here. We're soon to add a consent form in here where you could have the patient sign it. But for now, it's just verbal. So if you've got a form, you should have them fill that out, and you can take a photo of the form here to keep it with the patient documentation. So then you can click that, yes, you got that consent. And then we just hit the back button and that patient is entered. So again, less clicks, there's no save button, it's auto saving all the time. So if I were going to go for the rest of the clinic, I would be in the queues. So we do also enable clinic flow by adding in your clinic stations. So whatever clinic stations you have, you can put in here. So if you have if you've got a vital station and labs and exam, if you have 3 different exam rooms, exam room 1, 2, 3, you could put all those in here. And that way you could put the patient and have them move through the clinic flow as well. So in this case, I'm going to go into vitals. And you can see I have a couple of patients waiting for me here. So I would go into one of these patients and I would take a look and see if they have anything entered. We would likely do a new visit at this point. So now you can see I've got 2 visits here. One she had back in June, it looks like, and then we've added a new one here in October. So you can go back and look at the previous visits and there could be a whole string of them. And then you could look at the summary. In this case, it's a test patient. We don't have a summary here, but this is where you would review it and just make sure it all looks good. So look at the medical alerts, chronic illnesses. Again, you can select from those, do multiples if needed. Allergies, medication, surgeries. You can actually look at their immunization history as well. You can key those in here, or they can be fed from the individual visits. So you'll see back in the visits, we've got a spot for immunizations. So you can add those if you're actually if you've got your vaccination in that visit, it will then fill that history. So throughout here, then you just go through and fill in your information. So we've got some public health questions. We've got the complaint, immunizations. You can go through and enter vitals and they'll auto convert back and forth. You can put in your height. It will auto calculate BMI. Just put this in. And of course it's a demo, so we're playing around with this, so it's not working. But that is how it would work here in the vital section. Heart rate, head circumference, arm circumference, and we're now adding in, especially in the pediatric module, growth charts along with developmental milestones as well. And then if you wanted to order a lab, you could go into the labs. I could order, let's say we're going to do a blood glucose test, and then I'm going to put this patient in the labs. So if I go back here, you can see they're removed from vitals. So now the vitals nurse is not taking care of them. They're moved over to the labs. So within labs here, I can see she's way here at the bottom. So I would honestly take Moses first, but because they've been here the longest, but I'm going to just take her here. So if I go in, I see the labs. I'm going to jump in here. I'm going to click edit. I'm going to put in my results here. I could take a photo here if I wanted to of the results, say that it's complete. And we could always do multiples as well. So that's the quick labs. We'd probably move them on to exam. So within the exam, pretty straightforward. Within the exam notes here, you can dictate them or you could just type them in. But again, we're all about less typing, right? And speed. So here is how I would dictate my notes, period, new line. This makes it a little faster, period. So you could dictate your notes if you wanted to. You could have a scribe, whatever is quicker and easier for you. Could also take photos in here, just like we had earlier. I'll take it. Oh, that's a blurry one of my wall. But then you can have all those photos there that you could then blow up later for dermatology or for orthopedics. It's also good for your second consult as well. So then we've got diagnosis, and in here you can customize this. So we've got multiple fields where you can have customized lists. So if you want to see ICD-10 codes here, you could do that. Or if you've got Ministry of Health lists that you want to add in here, you could do that. Or if you're running just an HIV clinic and you want very specific diagnosis lists, you could do that as well. So you could run multiple lists depending on which group you're talking to. So we could put some of this in here. You could do 3 different types of treatment plans. Again, this is your list, your formulary. So if I wanted to do, let's say maybe a GI issue, I could just type in, again, it's a couple of letters and it'll shorten your list. So you don't have to type in the whole piece. So we could dispense 100 pills, which of course this doesn't make sense for all of you who are medical, but maybe putting this in, take these as needed. We would be much better as a medical professional. Remember, I'm on the tech side. So that could be your medication. Within here, you could also do in-office treatment. So if you have different different things that you're offering, if it's education, if it's certain nutritional program, if you've got wound care, or if you've got occupational therapy or physical therapy you're offering, you could put that list in here and just select from it. Again, trying to reduce the amount of typing, right? So you could add that in here, put treatment notes. You could add in a follow-up here. You're going to refer them, or you're going to do maybe return to clinic, have them come back. You could do that as well. So let's just say we want them back in 2 weeks. So you can also do multiple diagnosis in here. So we like to make things easy and flexible. So you could do another one, and I'm just going to throw something in here so you can see what it looks like. Okay, so at this point, we're going to move, we're going to move our patient here to the pharmacy. So if you see, I'm going to move over here to pharmacy, and you can see she pops right up. So if I'm the pharmacist, I'm just sitting in this queue waiting for patients to fill up here. So now I'm jumping in, I look at pharmacy, I can say, yep, I counted this one, and I filled. And I still have access then to go back and look at more of the details if I want to validate that it was the correct dosage. I did leave the in-office treatment plans here too, so that whoever's handing out the medications can then say, did you also go and get your occupational therapy? And if yes, you can say filled. If not, you can send them to the correct place where they need to go get that before they leave. So that is essentially the flow. So I wanted to give you a very high level overview of the flow. It's fairly straightforward as far as data entry. We tried to make it as less typing as possible. You could certainly add some notes in here for virtual care if you wanted someone to come in and look, and they can look in the virtual care tab and add their notes as well. And then the only other piece I wanted to show you would be different types. And so I won't walk through all of these, but I'll just show you how this would work. So if I were going to do in my new patient and I wanted to do a new type of visit, I could also have different types here as well. So if I were going to do maybe a general surgery or an inpatient, I could do any type of visit if I was a clinic that had multiple different services. So you can see this patient has had quite a few different visits. This is what it would look like. And as you can see, the general surgery has different tabs here. Anesthesia, it's got a surgery tab, post-op and follow-ups. So you could do multiple follow-ups here as well. So I just wanted to give you a quick rundown of it so you can have an idea in your mind of what it's like to use this system. And so with that, I guess I would welcome any questions if anyone has any questions they wanted to ask.